From the studios of Tucson Business RadioX, recorded in the Stewart Title corporate offices on Broadway, you are now listening to The Mark Bishop Show. And now here's your host, Mark Bishop.
And on this Mark Bishop Show, we're going to welcome Seema Verma, Administrator of the Centers for Medicare and Medicaid Services. It's nice to talk with you again, Seema.
Well, it's my pleasure, and thanks for having me today. I appreciate it.
Medicare Open Enrollment begins tomorrow, October 15th, and people with Medicare have until December 7th to make changes to their health plans or prescription drug plans or select a new plan for 2021. Seema, this year, Medicare plans have historically low premiums. Why is that?
That's right. And this is due to the president's leadership. You know, from day one, when I started this job, he made it very clear that he wanted to protect the program, modernize it, and make it work better for seniors, delivering lower cost, better care, and more choices. And that's exactly what we've seen year over year. Every single year that I've been in this job, the premiums have dropped. And, you know, overall, across the board, we're seeing about a 34% drop in premiums under the president's leadership. What's interesting is even in some parts of the country, it's more than 50%, more than 60%. So it's really delivered results. You've heard him talk a lot about drug pricing. So again, our drug pricing plans are at a low as well, a 12% overall decrease. And the brand new thing this year is the President's Senior Savings Plan. This is an insulin plan that is offering the insulin for just $35 a month, which is, you know, a huge savings, about 66% on average. So really, together with the Medicare Advantage premium drop, the new insulin program, he is putting money back in the pockets of our seniors.
Yeah, it's pretty good. I mean, it's quite ironic. Everybody hates this guy's guts, but he gets everything done. And he says that he gets done what he says he's going to do. Not bad for a president, in my opinion, but what would I know? Anyway, I don't get into politics much, but here's the deal. That means participating plans will offer a 30-day supply of insulin for $35 or less in 2021. So I think that represented something like a $446 per year on out-of-pocket cost for insulin. Now, some people do ask, why compare Medicare plans anyway? Well, folks, every year Medicare health plans change by cost, coverage, and participating providers. Even if a person with Medicare is happy with, you know, your current Medicare coverage, not all plans offer the same benefits. That's correct, Seema.
That's exactly it. And the president's also letting the plans, giving them more flexibility so they can offer more benefits with the idea of keeping patients safe, healthy, and independent. So, you know, for example, a plan in the past couldn't provide transportation services if somebody needed a ride to the doctor's office, or let's say they're recovering from surgery and they just need help with meals or somebody to come in their home to check in on them. And now we're able to provide those services under the president's leadership. So it is important to really look at these plans, look at the supplemental benefits. I can tell you there was one plan in Florida, for example, that was offering pest eradication services to all of their beneficiaries. I think they recognized that, you know, that was contributing to a lot of illness for our seniors, and so they're offering that benefit. So really important to look around, make sure your plan has the doctor that you're used to seeing. We have some new tools that allow you to just automatically upload all of the medications you're taking just with a push of the button. You don't have to manually put them in. It automatically uploads. Mm-hmm. And then that way you can pick a plan that has the drugs that you're already taking.
And this is what's new for 2021 as well, right?
Yeah, all of that's new. I think the big news this year is that insulin program. All of the plans are offering more benefits. You know, this year, 94% of plans are going to be offering telehealth benefits. That's something the president feels very strongly about. He signed an executive order, and we're seeing our health plans really step up to the plate, making sure that seniors have that as a tool. So even outside of coronavirus, we know a lot of them used it during the pandemic and continue to use it, but we're seeing that these health plans are going to make it a permanent benefit for our Medicare beneficiaries.
Well, you know, I had some questions here. We have covered open enrollment. It's important for people with Medicare. You know, briefly, why is it important? Why is open enrollment important in bottom line?
Well, the bottom line is these plans are competing for seniors' business. So they're competing on cost and on quality and on benefits. So it's an opportunity for seniors to get the best deal that's going to work best for them. The other thing I wanted to focus on today was kidney care. The president signed an executive order around improving kidney care. And we have a lot of our Medicare beneficiaries with end-stage renal disease. These are folks that are likely on dialysis. And the president is given new flexibility so that they can actually participate in the Medicare Advantage plan. So they get to shop around too, and that's something that's different this year as well.
So who can participate in Medicare Open Enrollment?
Really anybody on the Medicare program. We encourage all of our seniors to shop around, look at Medicare Advantage, compare it to the traditional program, figure out what's going to work best for you. Family members, I've got my in-laws and my parents on Medicare, and so we want to help all of them go through the process. Sometimes they need a little bit of support. So family members, make sure you check in with mom or dad or grandma or grandpa, see if there's anything you can do to help them through open enrollment.
And those that aren't, what do Medicare beneficiaries need to do, during open enrollment? What do they need to do now?
You get onto the website, Medicare.gov. You can also call our 1-800-Medicare number, and somebody can help you through the process. Also, across the country, there are local volunteers that can provide one-on-one support to help people through the process. So there's lots of opportunities to get help.
And when does it end, by the way? December. What was the date in December?
December 7th.
Well, there's a bit of
Pearl
time.
Harbor Day.
Yeah, there's a little bit of time. I mean, where can people go then to get local help in their own community?
Well, call our 1-800 number because they can direct you to the local resources. We can provide that help, but we can also tell you what's available in your community. And again, just going to the website, which is Medicare.gov.
And what would happen if people miss the deadline, Seema?
A deadline's a deadline. Obviously there are some waivers if there's extenuating circumstances, but generally everybody goes through the normal process during the timeline. It starts on October 15th, ends on December 7th. So, encourage everybody to get started in this process right now. I can tell you we've got seniors that on the first day of open enrollment, they're on the website, they're making plan choices literally on day one.
And does Medicare cover flu shots this year?
It sure does. Flu shots are covered. They're absolutely free. This year, we're encouraging everybody, please get a flu shot. We don't want to overwhelm the healthcare system. They've got their hands full dealing with COVID, and we don't want to have people sick with the flu. So it's an opportunity for you to do the right thing, get your flu vaccine. I can tell you the president is also making sure that when we have a COVID vaccine, we're going to make sure that it's safe and effective. We're not cutting any corners in the process, but he wants to make sure that seniors are prioritized and that there is no cost with the COVID vaccine when it becomes available.
That's a biggie, that one right there. Yeah, winter's coming up. There's a lot of people concerned about that and a little frightened. Don't blame them. The difference between the flu and the COVID-19 and the mixture of both and what to do. So, folks, really, I just had mine again the other day. You've got to get it done. Just get the flu shot and be done with it. Doesn't hurt, does it?
That's right. It doesn't hurt. If you got somebody who's doing a good job. I had the Surgeon General do mine this year, and he did a great job. I barely felt it. The other thing that's important to remember with COVID, obviously the standard public health messages, wearing your mask, being socially distant, washing your hands. I do think it's important to note that we've made tremendous progress. I mean, we have seen the mortality rate for people over 70 just decline dramatically. It used to be 1 in 4, 1 in 3, and it's now under 6%. So it's a real testament to our healthcare system and the overall response on coronavirus. Things are changing. Obviously, we all want to be careful, but I also want to make sure that people have the latest data and information.
Well, fabulous. And thank you so much for informing us, Seema. Time has caught up with us again. Seema Verma, ladies and gentlemen, she, as the administrator of the Centers for Medicare and Medicaid Services, she oversees a $1 trillion budget representing 26% of the total federal budget and administers health coverage programs for more than 130 million Americans. If that's not responsibility, I don't know what is. Thank you, Seema. Appreciate you chatting with us again and giving us the brand new ups for 2020 with reference to Medicare. Good on you. Keep up the great work, won't you?
My pleasure. Thank you, Mark.
All right. Goodbye.